Do you have any advice for patients who are newly diagnosed with myeloma, if a patient were diagnosed today, let's say?
The only thing that I can really say is that a person should always pay attention to their body and to what it's saying to them. If you have a pain that you've never had before, or anything in the patterns of what your body is normal to you is different, do not wait. Just go to your physician, find out what it is, and if they don't have an answer, you just keep going until they do have an answer. Because sometimes people just wait and it becomes too late for them, and then there's no cure for them.
So if a patient were to be diagnosed with myeloma by the local doctor, or they go to a larger center, would you have any advice?
I would always suggest a second opinion if they didn't feel that their first doctor was giving them the right opinion, or if they didn't feel right about it. Other than that, I don't have anything else. I think that's fine.
You're currently on daratumumab because the disease has returned back as a recurrence, and you have been on it for quite a while, and you really have no toxicities from it. There are ongoing clinical trials looking at the use of daratumumab even in newly diagnosed patients. I'm the lead principal investigator for one new trial we have just opened, where we use it in combination with carfilzomib and lenalidomide and dexamethasone. This is a study we have only open at Sloan Kettering, and preliminary data suggest that the responses are just amazing. They're very deep and very fast responses. There are other studies ongoing with bortezomib and lenalidomide and dexamethasone, where patients are randomized to either that combination or with the daratumumab. So it's a randomization either with or without daratumumab. Those data are about to be presented, and preliminary from what I've heard, it also looks very promising. There are other combinations done outside the United States where people have used thalidomide with bortezomib and dexamethasone, also randomized plus and minus daratumumab. My readout on the literature is that we probably are going to end up using 4 drugs, where daratumumab will be one of the 4 drugs going forward. And I think we will continue to see improved outcomes. Patients are going to live longer and longer with this disease. Hopefully we'll be able to establish a cure for this disease, and the toxicities are going to be less and less. This is fantastic.
Okay. Yes, it is. My opinion is that anything that can bring down a person's toxicity, that can have less side effects, negative side effects, is wonderful, because some of the therapies that are used, or the oral ones that I've had, have been so negative that I know I can't function, and that's the main thing. You want people to have a good quality of life. And I know that the regimen that I'm on allows me to have that.